Hello, this is Dr. Rafi Romano. I'm very glad to welcome you to our series of clinical tips, tips of the day. Today we will concentrate on lingual orthodontics, which I'm doing for many years. And our tip of the day today is the Boing effect. What is Boing effect? As you can see here in the picture, Boing effect is when we lose control on the teeth movement, we get extrusion of the front teeth, extrusion of the molars, and intrusion of the cuspid and premolar, as you can see here. Usually it happens in space closure. You can, of course, see more details on this phenomenon in the book Lingual and Aesthetic Orthodontics that was published by Quintessence Publishing. I want to show you a very nice illustration taken from the CD-ROM by my friends Kutsu and Takamoto. This CD-ROM was marketed by Omco many years ago. Now you can see in the illustration what happened when we try to apply force to close space. We apply the force, the wire is bending, we get extrusion of the molar, extrusion of the centrals, and intrusion of the teeth in the middle, the cuspid and the premolar. Now, the loss of control on the teeth can be solved in many ways, and we will discuss each one of them. You can see here an example of Boing effect, and let's see what is how it expresses this Boing effect. The Boing effect happens not only vertically, but it happens also horizontally. We can see that the wire in the middle is just bowed outside, and the molars are rotating from this loss of control. They are rotating the other way from buccal orthodontics, which is important to know. Instead of clockwise rotation, we get an anti-clockwise rotation, which should be solved now by our steps. So, what are the steps to avoid this Boing effect? The first one is, of course, to use stiff wires. When we use stiff wires like 16 by 22 stainless steel, the wire will not bend when we apply force. The second is we can compensate for this Boing effect by creating a reverse bends, which are the opposite of this Boing phenomenon. If we have intrusion at the premolar and cuspid area, we create extrusion band in the wire. If we have rotation, we can create a band which anti-rotate this rotation. You can see an example of these bands in the illustration here in the wire. The third one is to apply force in a very short span. If we want to close spaces, we can ligate the front teeth with a figure 8, ligate the back teeth, and then apply a short power chain between premolar and cuspid, or between premolar and molar if we extract second premolars. The next one is not connect chains to the terminal molars. If you put a chain from 6 to 6, we will have rotation of these molars. If we put a chain and we still have the 7, so the 7 will hold the 6 not to rotate. So try not to put a power chain on the terminal tooth. The next one is to add more anchorage. We can have a palatal arch, we can have mini implants, we can have a headgear, we can have nunce button. All these things will add anchorage to our system. The next one is to have a laboratory prescription in the bracket position. If we have a tendency for the teeth to intrude, we can make the bracket more gingivally to have extrusion effect. If we have tendency for the teeth to incline, we can have some angulation to upright the teeth. All this can be done in the laboratory or in the planning of the customized bracket system like Incognito, eBrace, Harmony, etc. 7, we can use loop mechanics. If you use loop mechanics like many Asian people are doing in lingual orthodontics, we can avoid these side effects. The next one, we can have wait until the molars will come into contact to have a better anchorage. We can bond, and we should bond the second molar. This adds a lot of anchorage into the system. We can have the anchor unit bonded passively, meaning that if there is no force between all the teeth in the anchor unit, they can serve as a good anchor unit to avoid these side effects. And we can have load on the anchor unit only later in the treatment, meaning that we first align the teeth and only then in a segmental technique, and only then connect all the teeth together to one arch and retract the teeth. We can add torque in the laboratory or in the wire. And with that, I conclude all the tips for this phenomenon called Boing effect. See you in our next tips. Thank you very much.